from Moi University and also a member of the Sickle Cell Federation of Kenya. In the Sickle Cell Federation of Kenya, I am the chair of the scientific committees. When it comes to Sickle Cell Federation of Kenya, it's an umbrella organization that brings together all stakeholders that deal with sickle cell disease. Its role is to take care of the welfare of persons living with sickle cell disease and also to set the required standards for care, education and research so that we can get the evidence and use the findings to guide changes in policy. Sickle cell disease is a genetic disorder of the red blood cells. It's inherited as an autosomal recessive condition. When we talk about autosomal recessive, it means those who receive the gene from both parents are the ones who suffer the lifelong symptoms. But those who receive the gene from one parent are called carriers, or they have HBAS. They generally live normal lives, but have the potential to transmit the gene to their offspring. While those who have normal hemoglobin, when tested, they are referred to as HBAS. So when it comes to management of sickle cell disease, we have three the WHO interventional strategies, which are categorized into primary, secondary, and tertiary. For tertiary interventional strategy, that is the care we give to all persons living with sickle cell disease. That is the medications, blood transfusion, IV fluids, even just guiding the patient to go to the facility. That is tertiary interventional strategy.
Labda utuambie leo shughuli ya leo imekuwa, kiini cha shughuli ya leo imekuwa nini? What is the main purpose of today's event?
The main purpose of today's activity is to raise awareness about sickle cell disease and to actually talk about the control of sickle cell disease.
Can I add? Thank you. My name is Emily Gumba. I'm the CEO of Sickle Cell Federation of Kenya. Why we are here today is because of the partnership we have with the Novo Nordisk Hemophilia Foundation, together with us and the county government of Kisii and other counties, to train the health workers to learn more how to manage the disease. But again, we are working closely with the community health promoters to sensitize wale watu mashinani wajue kama mtoto ako na ugonjwa selemundo anafaa kufanya nini. And our partnership leo tumesikia, it's not just about, we are emphasizing let every child be tested, let them be screened, and then they go to the hospital, they'll get the help. When they get to the hospital, we also have support groups. We are also advocating for medication because it's, you heard, it's a lifelong disease. The drugs are very expensive for most of our parents. We are grateful for the government who included sickle cell disease in the SHA. We are encouraging parents to also register for SHA. But importantly, blood. Today we are also here to talk about blood drive. We want people to donate blood because it's one of the lifeline for sickle cell warriors. So today's event is a culmination of other activities that has been ongoing over the year. We have trained the health workers. We want to talk to the community. We just wanted to say that yes, sickle cell disease is a high burden disease for many parents. And I think together, as the fourth estate, you can also help us share the information. But as Prof was also talking about, let people know their status so that you make informed decision when you want to start a family, or even if you want to look for a lifeline partner. That is the only way we can prevent the disease, by early detection, diagnosis, and then we see how to manage the disease. That is the message we have for people in Kisii.
Okay, where are we in terms of prevalence, especially from the western region? Sickle cell, in terms of prevalence.
I want Dr. Kini to share with us some of the statistics.
My name is Dr. Kini, the County Cancer and Non-Communicable Diseases Coordinator, Kisii County, and also the Chair of the Cancer and Non-Communicable Diseases Coordinators of the country. And I'd like to inform us that the burden of sickle cell disease is on the rise, especially the western region, where 18% of children born are having sickle cell trait, and 4% of the children born in Western Kenya have sickle cell disease. This is in our backyard. It is not far from us. As Kisii County, our positivity is also high. The children that we've been screening through Afya Dhabiti Sickle Cell Federation of Kenya and the Hemophilia Foundation, the support they've given us, we are getting to have 14% positivity on traits, sickle cell traits, and 4% positivity on sickle cell disease. This is a worrying trend which we don't need to bury our heads but start discussing. And the discussion is the difficult question. Unfortunately, we have to discuss either as elders, women, church leaders, the same way you tell young ones to get tested for HIV before they go and get married. Let's also have that discussion. Let them be screened before they get married so that we will know if you have a trait or not, so that we can reduce the cases. You know, if we keep on keeping quiet, the numbers will rise. The next time we'll be celebrating, we'll be talking about 20%, 10%. Is that good? That's a question that as leaders we need to ask ourselves. Let's not shy away. And if there's a child who has sickle cell disease, we can manage the condition here in Kisii County. Don't travel, because the burden also increases because of the financial responsibilities, like transport, food, accommodation, when you go to MTRH. Just like our support is coming from Genge, from MTRH. She's coming to teach us on how to manage, on how to educate the community, so that we don't travel all that way. That is a beautiful support that we will not shy away from saying thank you. And all of us, we need to take it with a positive mind and also discuss. Thank you.
Thank you so much.
About the machine that you are given.
So can we add something because of the machine?
Yes.
Yeah.
Because we cannot talk of early detection and diagnosis.
Yeah.
Songa
katikati.
Right. As they said, my name is John Kim. We work with a company called MXL. We develop technology for HB electrophoresis. These are miniaturized HB electrophoresis technology. The sole purpose of this technology is to decentralize healthcare access, especially when it comes to early detection, management, and therapy monitoring for sickle cell disease and other variants. So the technology is able to kind of capture all many key variants, including beta thalassemia as a part and parcel of it. So for today, again, as Prof has said, and also the C has also talked about, and I think Dr. also mentioned, early detection is key. And to me, coming to this institution, Kisii Polytechnic, is a statement to say that young people now need to come out and make that decision and know their status. We have said migration has contributed significantly also to this situation. So when you talk about costing, in today's world, the technology of choice is HPLC system, which is highly chromatography technology, which is cost prohibitive in our environment. So many patients, as you know, our communities, we are not well-off communities, so it becomes very difficult to know your status in good time because of those cost prohibition. And that's where Gazelle comes in, bridging that cost gap, making it quite easy and quite affordable for the public to get closer to their care and get to know the decisions, and also to monitor the patients already in care. So this is a technology that is definitely going to change how we manage and how we detect sickle cell in real time, and equally give us insights as a nation on how big the problem is, as well as what are the mitigating strategies we need to put in place. One of them being cost. It's very costly to be a patient with sickle cell. And in today's world, again, knowing how our families are, it's one thing that we have to create for. The second thing is about demystifying the cultural barriers that still puts barriers to sickle cell as a disease. It's not a death sentence. We worked through the HIV period. We can still work through this particular mechanism. So thank you very much.
Thank you.
Samuel Isaji, clinician representative Western Region. Sickle cell and hemophilia, they are like twins. So when we are like establishing a clinic for hemophilia, we also think for having a clinic alongside for sickle cell. So in hemophilia in the whole country, currently we have estimated 950 patients, and in Western Kenya they are around 350. Here in Kisii we have an average of 20 patients, but we are working very hard so that we identify more patients, because in the whole of Kenya we are supposed to have like 5,000 male patients who are affected with hemophilia, and you see we have that gap. Up to now we have only identified up to 950. So we are working hard with the county governments, the hospitals, all the institutions, even the families, the community, so that they assist us in getting these patients. So any patient who is complaining of or maybe excessive bleeding after circumcision, after dental extraction, or after surgery, they bleed a lot, we encourage that those patients, they come to be tested. We have a machine here in Kisii, semi-automated machine. The testing will be done. And in terms of treatment, we give factor. If factor is not available, they can still get blood products, that is FFP and cryo. And we are not leaving aside the women bleeders. Of course, we can concentrate on the male, then we forget the female. So we are encouraging any female who have problem, maybe after menstrual they bleed a lot, or after delivery they bleed a lot, or after any surgery or nose bleeding, we encourage them to come for testing. So testing is done here in Kisii, but in case they want further testing again, it can also be found in MTRH and KNH.
Thank you.